Hello, my name is Stacey Pitts, and I'm the co-founder of CBD BioCare. And joining me today is Dr. Frank Michalski, and he is a chiropractor from Buffalo, New York, and an expert using CBD and CBD BioCare. Welcome, Dr. Frank.
Thank you for having me. As always, thrilled to be here.
Well, today we are going to be talking about a very important topic, and that's cardiovascular health. Cardiovascular disease is the leading cause of death in this country. It affects so many people. If it doesn't affect you, it certainly affects somebody that you love. So the question of the day is, this disease is so common, so how can CBD potentially help someone dealing with this disease? So Dr. Frank, let's first identify what is cardiovascular disease.
Yeah, of course. That's a great question. And before we identify it, I'll add on to some of those statistics that you said, because we don't think how common this is, right? Because cardiovascular disease typically is the silent killer, right? Sort of like inflammation. People don't know they have it. Let's explain though, just how many people are affected. These are some amazing stats. 610,000 people a year will die from a cardiovascular related event. That's 1 in every 4 individuals, right? So if we're in a room of 4 people, 1 in every 4 will be affected. It is the leading cause of death among men and women. And then to that last point that you made, coronary artery disease, which makes up a bulk of cardiovascular disease that we're going to be discussing, it kills 370,000 people a year. So when we think about that, again, it's easy for us to either say, wow, I might be someone who's affected by this, or I know someone who's affected by this. So let's talk about what exactly coronary artery disease is. And I want to emphasize, if people didn't listen to our last podcast on inflammation or diabetes, this plays into that perfectly. So if you guys didn't watch that, go listen, watch that, and then come back to this. So coronary artery disease, and I'll explain it in a very basic level. So imagine you have an artery, right? An arterial hole, and this is an artery traveling to my heart. And the job is for blood to pump through that artery, okay? Now, a brief science lesson from last time we spoke. The more sugars you consume, the more inflammatory things, smoking, sugars, alcohol, tobacco, whatever it is, that's going to increase inflammation in your body. When inflammation increases in your body, those little inflammatory chemicals will actually go to damage the walls of your arterial system. When that happens, your body is smart. It inherently wants to fix itself. So it's going to start to produce more cholesterol. Cholesterol, or plaque, is eventually going to start to build up around that artery, and it's going to create a stenosis in that artery, cutting off blood flow. So when we talk about coronary artery disease, when we talk about cardiovascular disease, you may hear the word infarction or infarct, and what that's referring to is a lack of blood flow to the area. In this case, specifically the heart. So most people think of a heart attack. Again, these are very rarely things that happen overnight. When we talked about inflammation, you don't just wake up one day inflamed. This is a buildup from years of damage. Those arteries to the heart start to close. Blood flow is decreased. Now blood pressure goes up, right? Because your heart has to work a lot harder to try and get blood back to it, to get the blood perfusing that area. And eventually there's not enough blood and someone has a heart attack. And that's really what makes up the bulk of coronary artery disease. It's that low level inflammation at the artery. Cholesterol builds up, it closes off the space. We no longer have blood flow to the heart, and now we have a heart attack.
That is a great description because it's so clear. And there's so many different signs and symptoms and heart disease. And we really could spend this entire hour talking about all the different types of diseases and issues with someone who has cardiovascular disease. So now, of course, the question of the day is, what can CBD potentially do to help people who are struggling and fighting this disease?
Of course. And there's one other thing I'll mention too before I jump into that. If anyone listening has access to their blood work and they want to look at it, because sometimes too I like to lay this out when I'm describing it. If they look at their blood work, you want to look at your total cholesterol, your HDL, your LDL, and your triglycerides. For those of our viewers who have triglycerides over 100, that's an independent risk factor for coronary artery disease or stroke. So irrelevant are your cholesterol levels. If you have triglycerides over 100, you should already be thinking about this. If your LDL, your bad cholesterol, is much higher, you should be thinking about this. Even more importantly, worse than having high cholesterol is having low HDL and high triglycerides. So if you're good cholesterol, HDL is low, start thinking about coronary artery disease. The other value that we talked about last week was C-reactive protein. That's how you actually measure the inflammation in the arteries to an extent. If people haven't had that value and they have high triglycerides, high LDL, they may want to speak to their physician about getting that value. And of course, as we know, diabetes and cardiovascular disease run hand in hand. So anyone with type 2 diabetes should already be thinking ahead to cardiovascular disease, and if they have risk factors that show up in the blood work for that. If our sugars are high, we're predisposing ourselves to cardiovascular disease. Those sugars are what play a big role in damaging the arteries. So I just wanted to mention that. Now, if you're looking at your blood work and you're seeing some of these things, you might start to think, okay, I'm a candidate potentially for using CBD oil. So the question was, how does CBD oil, or what are we seeing, how it benefits cardiovascular disease? Now, I want to say this. CBD does not appear to have direct effects on the heart itself. The research when it comes to CBD and cardiovascular disease is still young, but there is some conclusions or some hypotheses that are starting to be drawn at this phase. So right off the bat, CBD is a vasorelaxant. So it helps to relax those arterial walls. So if we could imagine they're tight and they're constricted, CBD has the ability, as of right now, to relax those arterial walls. So that's one thing. Now, why is that important? That's going to help more blood flow to the area, right? Because cardiovascular disease, lack of blood flow, more blood flow. CBD, this was according to that government patent, it's a very strong antioxidant. Again, going back to our discussion on inflammation, as we know, there's oxidation, that cellular rust that we talked about occurring in our arteries. They're rusting away from all this plaque buildup. So CBD is an antioxidant. Think of an antioxidant as something that helps to fight that cellular rust. So from that standpoint, it's very promising. The other thing that they've been studying a lot is CBD's effects on blood pressure. Now, this one's pretty fascinating. I believe I've personally benefited from this using CBD. I can tell you, prior to using CBD and making some other healthy lifestyle changes, my blood pressure was always high. It runs in my family. It's a genetic thing. My father actually had 5 bypasses before the age of 40. Every male in my family has had a major heart surgery before the age of 40. So this is an important one to me. So when it comes to managing blood pressure, one of the things that they're really studying is stress and the connection between CBD being an anti-anxiety and anti-stress-based supplement and stress's effects on hypertension, right? If someone's stressed, they're more likely to have elevated blood pressure. You'd hear that common phrase, someone's upset, and they say, oh, my blood pressure's through the roof, right? So what they're starting to find is that because of CBD's effects on stress and its positive effects on anxiety, that it may be indirectly lowering blood pressure via that route as an anti-anxiety, anti-stress style supplement, as compared to having a direct effect on the arterial walls themselves. Now, this one I think is super exciting. This was one of the reasons I spoke to my father about CBD oil when we really wanted him to start using it. The other thing that they're finding in mice is that after there's an infarct, so after there's no more blood going to an area, specifically your heart, there's tissue damage, right? Our muscles, our heart being a muscle, need blood to grow, to heal. If you don't have blood supply to the area, that tissue actually dies. This is called necrosis. If you know anyone who suffered a heart attack or had a bypass, one of the indicators for how long they're going to live after that, they'll always say how much damage was done to your heart, how much of that tissue died. What they're starting to find in animal models is that CBD may play a significant role in starting to heal those dead tissues and actually bring them back to life to an extent. Now, even more exciting for someone like me who's trying to avoid having a heart attack, they're studying perhaps a CBD from a standpoint of prevention, right? So is someone who's at risk of a heart attack and at risk of tissue damage going to benefit from using CBD oil? So I think in the future, we're going to see a lot of studies going that direction, just as we discussed last week for CBD and prevention of inflammation, perhaps in prevention of cancers down the line. We don't know what direction it will go, but certainly from that standpoint, we've seen some very promising studies coming out.
It's really fantastic to hear you talk about it. We always get really excited about the potential of CBD and what we still are learning. And because it is still in its infancy, even though this plant has been on the planet for thousands of years, we're just now learning the medicinal benefits. And as Dr. Frank mentioned, there's clinical trials going on, and now more than ever is our country and our government more receptive to the idea of cannabis. But it's very important for you to make sure that you're talking to your own practitioner and working with them. Dr. Frank, speak to that a little bit, because you mentioned before that if you're maybe a cardiovascular patient currently, that you should be working with your physician on a regular basis. And I think it's also important to note that not all Western medicine physicians are on board with CBD. So if you want to look for more alternative methods, such as using a full spectrum CBD, it's important to seek out a practitioner who subscribes to more holistic medicine, correct?
That is so true. I can say it's over the last few months, it's definitely been better received in traditional medicine, but not everyone's there. No. Or the response that patients are getting is, well, I don't know. I just don't know about it. Sure, go ahead, which I think is a disservice to the patient at the end of the day. But nonetheless, yes, you always want to work with your physician. And the reason being is CBD is metabolized in the liver. This is something I get asked about a lot. Does it interact with other medications? Yes, there's 60% of the medications on the market are metabolized in your liver. So is grapefruit if you eat grapefruit, okay? So what happens when you take CBD with those medications? CBD may increase the amount of medication present in your blood or decrease the amount of medication present in your blood. For most people, this really only pertains to medications that you're regularly tested for. Blood thinners are one of those medications. Chemotherapy drugs are one of those medications. This is an easy thing to get checked though. All you have to do is speak to your physician and say, listen, am I concerned about one of these medications building up in my blood? Am I concerned about any of these medications interacting with grapefruit? If the answer is yes, through some simple blood work, they should be able to monitor it. Now, as a disclaimer, I'll say at any dose, if you feel you're at risk, you should speak to your physician. Generally speaking, if we're seeing below 250, 300 milligrams a day, and we've even seen studies go much higher than that, the likelihood of it interacting seems minimal right now. Now, with that said, CBD is very individualized, so I don't know how you're going to metabolize a medication versus how I'm going to metabolize it. This is why one person takes perhaps a painkiller and they feel fine and another person gets knocked out for days. We can't say for sure how that person's reacting to that medication. So that's just one of the things I like to mention when it comes to cardiovascular disease and using CBD oil. It is best to ask. It's usually some simple blood work, but in the big picture, it's probably only a few medications. Those blood thinners would be a big one, and the chemotherapy medications would be another one.
Now, you mentioned grapefruit. I want to make sure it's really clear to our audience that grapefruit is a little bit of an anomaly. So why do you keep referring to grapefruit? Let's explain the connection there.
Yeah, because some of the same compounds found in grapefruit are broken down by your liver, just in the same way that medications are broken down by your liver, and just by the same way that CBD is. So on a really basic level, your liver has enzymes to break down different medications. The same enzyme that breaks down CBD also metabolizes grapefruit and other medications out there. So if that enzyme is busy metabolizing CBD, it may affect how your body's metabolizing the grapefruit or some of the other medications on the market. Most people don't realize it. Most over-the-counter anti-inflammatories actually have that same reaction with the liver. And when's the last time someone's taken an aspirin and thought to themselves, oh, wait a minute, should I not be taking this because I can't eat this with a grapefruit? So just to put it into perspective, I like to use that example. But yeah, your CBD is metabolized by the same enzyme in the liver that grapefruit and a bunch of other medications are. So that one enzyme can only do so much at once. If it has to try and compete for CBD and grapefruit and a medication, it might get a little overwhelmed, and that's when you may see medication levels increase in the blood.
Okay, so if someone is taking a prescription right now and it says do not take this with grapefruit, should they avoid CBD?
So this is what I would say. I would say speak to your physician about it. A simple phone call may do the trick. And I would call and say, listen, are we concerned? I'm looking at CBD oil. It's metabolized in my liver. This is exactly what they can say. Should I be concerned about any of these medications accumulating in my blood? At the end of this, what I'll do when I send out the recap, I'll send over a list of those medications and kind of some guidelines that people can use and go by that we've seen as far as interactions go with medications. But that would be the question. You call your doctor and you say, listen, CBD breaks down in my liver. Am I worried about any of these medications accumulating in my body because of that competition for CBD? Your pharmacist honestly might be a better bet than asking your primary care physician, depending on how receptive they are. But a lot of times we'll tell people just to go speak to a pharmacist. If they're quick to say, oh, don't use that, and they just brush it off and they really don't have an explanation as to why, seek a second opinion. Because really, when you order the blood work, when you do the testing, this is an easy solution. We can easily take this with medications. It may just require a little bit more monitoring. But yes, they should check with their physician.
Okay, that's great. And again, this is a newer supplement to the marketplace, and so it's always good, no matter what you're doing, to consult your physician. But CBD is considered generally safe. To date, I don't know of anybody that has ever died from it consuming cannabis at all. So it's generally considered safe, but always we want to disclose that you should definitely partner with your physician. That's always good advice, right?
Absolutely.
Let's talk about a serving size. We've talked about possible medication changes depending on the amount of CBD. So let's talk about what a serving size would be for somebody that has cardiovascular disease, or may have a family history, or is just trying to be healthy to avoid inflammation in the cardiovascular system.
So yeah, of course. So this one is really, this is a great question when it comes to dosage for cardiovascular disease. So what I would recommend is this: starting at a very low dosage, like we always say. And the reason being is, let's say you do have hypertension and you're currently being medicated for high blood pressure. Now, maybe at 10 milligrams of CBD, blood pressure doesn't change. Perhaps you hit 20 to 30 milligrams a day and your blood pressure does start to go down a bit. Well, you may need to adjust with your physician those medications appropriately. So why would this be bad? Let's say someone goes right off the bat with 200, 150, 300 milligrams of CBD a day. We don't want someone passing out because of a dramatic decrease in blood pressure. I've never seen that happen, even at higher dosages, but that's why we always caution start slow when it comes to cardiovascular health. The blood pressure is probably the biggest reason. Now, the other reason too, and people don't usually consider this, so going back to hypertension, high blood pressure, let's say it is related to an anxiety disorder or a stress disorder. Someone may find that at the right dosage, that anxiety feels great. And it might be a very small dose. We have people who take 30 milligrams a day, even 5 milligrams a day, and see good results. We have some people who have to take 200 milligrams a day. Now, why would it be an important case if we're trying to lower blood pressure in the presence of anxiety? Because we know if you take too much CBD, it has that biphasic effect. So at too low of a dose, it doesn't work. At too high of a dose, it may have the opposite effect. So in the case of anxiety, we wouldn't want someone to be more anxious because, one, they'd have more anxiety, and two, their blood pressure may go up. How do you avoid that? Start slow until you hit that sweet spot and then stay there. You can always increase. It takes a little bit more time to decrease. You'd rather avoid a reaction. The other thing too, which I know we briefly discussed at one point when I was speaking to, was arrhythmias when it comes to the heart. They're studying and actually seeing a lot of great benefits when it comes to rapid heartbeat or tachycardia. I have had female patients tell me before with the CBD, and they were actually usually typically using it for more insomnia type symptoms, menopause, hot flashes, that it seems to speed up their heart rate a little bit, that they get a jolt from it. So that would just be something to be aware of. And again, how do we correct for that? We simply say, okay, take less. If it's a healthy patient and they don't have a high risk for having some tachycardia and all types of problems, easy solution, take less. We don't have to worry about it. 99% of the time we've seen that just go away. So everyone's individualized. Start slow, but at the end of the day, I recommend starting between 10 milligrams, and blood pressure is nice because that's something you can track day to day. You don't really know how much cholesterol buildup you have in your arteries. It's very hard to know that until, unfortunately, you have a stroke or a heart attack or go in for some advanced testing. So we can't say for sure if you have high cholesterol, take 100 milligrams a day or 200 milligrams a day. So I tell people to stay in that pretty standard range of 10 milligrams up to 100 milligrams a day, but try and monitor some of the other things that may be indicators for the cardiovascular disease. Hypertension, are you less anxious? Are you sleeping better? Looking at all those lifestyle factors may be a better gauge to get the correct dosage than saying, oh, is this helping with my cholesterol, or is this widening my arteries? Again, you're not really going to know without advanced testing.
You know, CBD, as I always mention, it never ceases to amaze me, because when I'm listening to you, we're talking about cardiovascular disease, we're talking about inflammation, we're talking about anxiety. CBD helps with all of it, right? So if you're helping someone sleep better, then they're going to most likely have less anxiety if they deal with that on a long-term basis. And if they're sleeping better, they're going to have less inflammation, right? I love that it's a holistic approach. And one of the things that CBD has been found to do is balance, right? Create homeostasis. So if there's something out of whack in your system, it helps to bring that into balance. So the same seems to be true with cardiovascular disease.
It really is. And I think people listening to this are going to see that story over and over again. And it's really an amazing thing because we're finding the science behind that. So a little more detail on the blood pressure. So say someone's very anxious. The connection to that individual may be that they have decreased serotonin levels. Well, we've shown now in clinically that CBD positively impacts serotonin levels, which is that feel-good hormone. So it's fascinating to think, wow, I have hypertension potentially due to my an anxiety, but CBD is correcting my serotonin levels, and in turn, something like serotonin, which really doesn't affect blood pressure, is now benefiting my blood pressure. It really is an amazing thing. And seeing all these pieces of the puzzle come together is really fascinating. When I send you the write-up on this, I'll go into the science a little bit more for people who really want to try and fully understand these different mechanisms of how does it expand, how does it relax your arteries, how does that work? So something else I'll say too, and I believe I said this last time, this is a great opportunity when someone starts using a CBD product to make those lifestyle changes. So say we're working with someone who smokes, they have cardiovascular disease, nutrition is not so good. This is a great time for that individual to start making those changes. Hey, I'm taking CBD oil now. It's been shown to help with, nicotine cessation, and I'm going to start eating healthy now. Now is the time where I'm really going to start to try and use this truly as a supplement to help with all those other lifestyle factors that should also be addressed. I mean, I tell people all the time, don't spin your wheels. Don't waste your time taking something if you're not going to try and better yourself on top of whatever you're taking. So something else I'd love to throw in there too, and then we'll go back. But when it comes to these cardiovascular drugs, some of these drugs are harsh. And we see people get off these drugs all the time. I'll talk about statins. We see it all the time where people come in with myalgias. Statins predispose your muscles to breaking down and wasting. Well, we had a case once, this was through the gym that we work with, where a man actually lost function in his legs due to statins. He was diagnosed at Cleveland Clinic. His legs gave out while he was driving through a toll booth, and he actually hit the toll booth. And he went through all the testing in the world, and a resident at Cleveland Clinic diagnosed it as an aversion to the statin drugs. Within 2 weeks, he was back to a normal life. So that's not saying all statins are bad and that people shouldn't be on them. Some people, they need to be. But you should always try your best to try and take care of yourself. Try and work with your physician to get off these medications. A lot of times we see people are able to. So don't think just because you're on something, it's well controlled or it's well taken care of, or I'm going to eat, a pizza and take some CBD and take a statin. Don't think that way, because it's not how it works. So.
Well, I love the holistic approach. I know your background's in functional medicine as well. And really what we are a proponent of is looking at the body holistically, because we now know more than ever that everything affects everything, right? We're all connected, and the CBD is really helping people with that. So I appreciate your knowledge and your information about how people can use CBD to help them in a number of areas. And you mentioned also that you do a write-up. We post Dr. Frank's write-ups in our blog section on our website. So please visit that at cbdbiocare.com. And you can read more about Dr. Frank and also how to get a hold of Dr. Frank. We're going to make you really popular.
Yeah, we want to help. We enjoy working with you guys. You guys are a fantastic company. So we're happy. The more people we can help, the better.
Well, thanks so much. Have a great day.
You as well.
Thanks.